Your fertility is a part of your healthcare. If you get the diagnosis of infertility, it's a disease.
Asima Ahmad is the co-founder and chief medical officer of Carrot Fertility, the leading global fertility, family building, and lifelong hormonal healthcare platform, providing care for everyone, everywhere.
When I was in my fellowship, people came into the clinic already having depression because they'd been struggling with fertility for a long period of time.
That word, infertility, can be so triggering.
It is a very strong word. It is a condition, but there are things out there that will help get to the goal in the end.
Many people, when they hear that they're going to have fertility struggle, they start to blame themselves.
It is about educating. That's how you spread the word and help others.
Fertility historically has been seen as a luxury. So how was your approach different?
People think of it as a luxury because they haven't considered it as being an essential part of healthcare. It's about
Expert care for menopause and sexual health, now just a click away. Virtual Care by Her MD offers longer visits, personalized treatment plans, and trusted providers, all from the comfort of home. Learn more at hermd.com. This episode was sponsored by Her MD.
Welcome, Dr. Asima Ahmad, my friend and colleague, and I would say mentor.
Oh, mentor. I'll take it, but I wouldn't say mentor. But a really, really good friend. I'm honestly so glad that I met you. The last, what was it? Now has it been like 1 year, 2 years?
I think it was 2 years ago.
Yeah, but it's so nice to have you in my life. I'll be completely honest. Just another woman trying to make the lives of other people better and in innovative ways, things that we've never done before, but are looking forward to.
Yeah, we don't see a lot of people who look like us in our space, do we?
No, and definitely not Pakistani.
No, not Pakistani. And I know exactly the moment I met you and I saw you. We were at the Swell event.
Yes.
I don't remember what city. And in comes this girl. First of all, she's dressed to the nines. She's got gorgeous hair and amazing shoes because I love shoes.
Same.
And she walks in and I could feel I'm data driven, but I believe in energy. And I could feel the energy. And I walked up to you, we said hello, and you were like the warmest, you were like a giant warm hug. And I was like, I'm going to love this girl. And before we were even done with the conversation, you were inviting me to Chicago and you're like, when can we get together again? Because you were going on stage before me. And that is literally the whirlwind of how we first met. And then we kept in touch.
Yeah. And it was like, I think it was like in the green room because there were people in and out, but I was like, I need to talk to her. I was like, I feel something. I'm like, I need to talk to her. Like, we need to get to know each other. And it was so natural. Like, I didn't feel like I didn't know you. Like, I felt like the conversation almost felt like it was starting where we left off, but we had never met each other before.
No, that was that same warmth I felt. I was like, people will say that when they meet me, they're like, you're a warm hug. And that's the way I felt about you. That's why I'm saying when you walked in, aside from the clothes, the shoes, and the hair, I was like, I want to know that girl. But then when I started talking to you, I was like, oh my God, it matches. Her inside matches her outside. And I loved that. So talking about being in this space, we're both founders of healthcare companies. I don't know what odds you were told, but I was told that as a minority woman, I had less than a 2% chance, actually less than a 0.5% chance of raising any funds. I was able to raise 40 million to date, but today's not about me. It's about disrupting and disruptors. So I want to hear about your founding story. Can you share that with everybody? Because they need that inspiration.
Yeah, for sure. So to be honest, I didn't even think I was going to do what I'm doing today. I knew I wanted to do something different, and I knew I wanted to take care of patients, but I knew I wanted to do something else. And I thought that was going to be in a different space. I had, done some work with the WHO, just like a short period of time, but I had done some relief work, like disaster relief work, and worked with different organizations that way. So
where did you do that?
So now it seems so long ago. It feels like it was yesterday, but now that I'm going to tell you the year. So it was during medical school, and it was when that really big South Asian earthquake took place. The epicenter was Muzaffarabad. In the Kashmir area, and I really wanted to go, but I had no experience. I didn't want to stay. I was a medical student, and I hadn't gone there alone. I hadn't gone to Kashmir, and I definitely hadn't gone there alone. And I didn't have any resources, but what I did was I was lucky that I went to a medical school that didn't require you to be in class all the time because I like to teach myself sometimes. I get really distracted in class. I found out later as an adult, actually, when I was doing my master's that I have ADHD. I didn't know that as a child, but I was always like distracted and looking around. So I would just teach myself whatever we needed to do for medical school.
Or future entrepreneur. We make good students, but not really, and bad employees, but really, really good idea makers. And yes, okay, change makers.
Yeah, so then I would stay up all night trying to figure out how I was going to be able to go to Kashmir to do this relief work. And then like during the day, I would try to like learn what I needed to do for medical school. So I wasn't getting much sleep. But in the end, it was like months of work, but I was able to put together 2 different trips where we had people who were going that were in the medical space that were helping out. I had social workers. I had people in finance. I mean, it was amazing. It ended up being a life-changing trip. And I kept in contact with a lot of the teams that I had worked with there and, continue to send volunteers and work with them. There was a period of time that I had to, and I still kind of have slowed some of that down just because I feel that when I'm not there in person to make sure everyone's okay, like I almost feel, I feel responsible, right? And so, so that's kind of how I got started in that. But that's what I thought I was going to do, Doctors Without Borders or something like that. So when I was in when I was in my fellowship at UCSF, that's when I met my co-founder. I happened to be at a conference, and my mentor was doing a panel on cost-effective fertility treatments. And she came up to me. We started talking, and we realized we're both from the Bay Area, so we connected again there. And she had been a fertility patient, and I was in the fertility space doing my training. And we were talking about all the barriers for people to be able to access fertility treatment, how the experience itself had a lot of friction. People had experiences that were not ideal. There was a lot of stress involved, a lot of emotions, a lot of depression. And a lot of times people came into the clinic already having, that background because they'd been struggling with fertility for a long period of time. So for a while, we brainstormed about what would be the best approach, and we had a lot of ideas. It's actually funny because some of the ideas that we came up with that we decided not to move forward with are actually startups themselves now. So I won't say which ones, but I'm like, whenever one of them starts doing it, Tammy and I like reach out to her, she's like, oh my God, remember when we thought of that?
Yeah. And it wasn't going to work for us. Yeah.
Yeah, but there's so many things to do in the space, which is great. So what it came down to was the biggest barrier for people overall was getting into the clinic, and that was tended to be financial. It was definitely the case in the United States and in even countries abroad. That was something that we were seeing. We decided we did want to make a company that was a global company, so we wanted to focus on all countries. Of course, like us being located in the U.S., that was where we were going to start. And we focused on creating a model that would reduce that financial burden on people, but also be able to get them that high quality care at the time that they need it without those delays. And of course, as you know, delay to, fertility care also affects your outcomes. So that was like how it all started. But the funny thing is I never thought I was going to be doing this.
So why the name? I'm curious. Right?
I know, and I happen to be wearing orange today.
I usually am all red, and I got the orange memo, so it's about carrot today. So,
well, it's funny because like we didn't choose it. Like people think that we chose carrot because it has to do with rabbits and fertility and them having lots of babies.
I'm not gonna lie, my mind went there, and I was like, I know her. I don't think she would have gone down that route. And then I was thinking, oh, is it because it's growing? But there's lots of vegetables that grow. So
yeah, I think it was just because it's an easy name. It's something that's overall healthy. At the time that we were choosing it, we didn't think that it was gendered in any way. We thought it was all inclusive. And I joke, I'm like, hey, Apple has nothing to do with like tech and
so fun.
like computers and laptops and phones, but here, Apple was fine. So there's carrot.
Okay, I love it. So I love the fact that just because minority founders aren't the fact that we are rare doesn't mean that we don't have incredible ideas. And I love the fact that you kicked down a door and you made fertility care accessible. I think that's amazing. So what do you think to date is everyone, I mentor founders and I want to bring other women to the table because I want to smash the status quo, not only in healthcare, but in fundraising and being an entrepreneur. And I don't want women to think that it's such a big leap or barrier that they can't do it. And so I think on social media, people get to see all of the highs, like all the wins that we have, but we don't talk about, like you and I do on the phone, but the hurdles or the struggles or the hidden journey, right? Because that you don't post that. We don't put that up there. It's almost like motherhood. You know, we only post the really pretty pictures of the baby. No one posts the, you know, the poop diaper that's exploded on you in the middle of the night. So what's been your biggest hurdle that you are willing to share?
Yeah, you just reminded me of how my kid's diaper leaked all over me the other day.
Oh, okay. Wait, you're still in the thick of it. I forgot. Mine are older. Okay.
Yeah, just like the other day, I'm like, "Are you actively peeing right now?" He's like, "Yes." I'm like, "Okay."
You're like, on me?
Yeah. I was like, "Your diaper is leaking." So I think one of the most challenging things that we encountered along the way was that a lot of people didn't understand what fertility was and that it was something that needed to be addressed. They would think about, okay, reproductive health and contraception and family planning, but not that some people actually need help to build their family.
Yeah.
And there was it was a hurdle and it was a challenge, but it was almost like a positive thing.
Yeah.
Because part of what we do as physicians, right? We're always educating our patients. It was a form of education for people.
And advocacy.
And just going out there and talking about it and talking about like, hey, your fertility is a part of your healthcare. It's not an elective thing.
Right.
Right? If you can't get pregnant, for instance, if you're in a heterosexual relationship, you're trying to get pregnant, you have the diagnosis of infertility, it's a disease. It's not something that you're just doing for social reasons. Like your ability to grow your family, to use your body, your organs, your eggs to have that child, it's a part of your health. And I think that was this is the biggest point here, is that it should be covered, as a part of whatever coverage you're getting for your health care. It shouldn't be thought of as an add-on. And that's kind of how the conversation was with dental and vision initially, right? It was an add-on, but it shouldn't happen.
No.
Right? And so that's where I want fertility to be.
Yeah.
That it's a part of the package. It's included no matter what at the baseline.
And it's accessible.
Yes.
That's key. Okay, so that was your hurdle. What was one of your either biggest wins or favorite wins or just moment that you look back at other than becoming a mom? Because I know you and I have shared that joy, but what's been your biggest win?
So I don't know if this is a direct win, but I feel, so when we launched the company, we decided that we weren't going to talk about it as infertility because we wanted to be inclusive. And infertility, again, that historical definition is a heterosexual couple having regular unprotected intercourse over the course of a year without getting pregnant.
Correct.
And there are a lot of people out there that don't meet that definition, but do need access to fertility care to grow their family. So we, from day one, called it fertility.
Right.
It was always fertility benefits. It was never infant. It was always fertility benefits. And in addition to that, we thought about all pathways to growing families, which also included adoption. And when I think of fertility treatments, I think of surrogacy, gestational care, and all that. So it's just inclusive of all people, all backgrounds, and all paths to parenthood. And so I say this might not be a direct win, but I think with all the education and all the discussion and starting that, whether it's a culture or what, about referring to it as fertility has also resulted in other people adapting that definition and that approach. So the American Society for Reproductive Medicine in the past, now I can't remember the exact date they changed their definition. I think it's been about a year now, but they changed their definition of infertility to be more inclusive of people who need to do fertility treatment to grow their family, which includes maybe a single female who needs to use donor sperm, or a same-sex male couple, or a same-sex female couple, and that wasn't included in that historical definition. So I think just overall, I'm so happy that has changed and is being changed. I mean, it's not global yet, but it's being adapted and it's being talked about in that way.
No, because that word infertility can be so triggering. I did this project with, I feel like we're naming fruits, vegetables, and food, which we do, but Peanut, the organization, and they did a campaign called the Renaming Revolution, and it took apart all of the harmful terminology in medicine. And I actually, when I sat down with a psychologist and a linguist and looked at the words that we just learned in medical school and residency, and I put in people's charts because they matched the ICD-10 or 9 or whatever back then it was codes so that the visits would be covered. And my biggest learning because I had a fertility struggle and my babies are Clomid babies and because I have PCOS, but I had shared with earlier on in my career, I had used the word infertility because she had met that definition and I was sending her to someone like you, an REI, right? Because I had reached the end of what I knew how to do and wanted her to get care. And I'll never forget this. I have goosebumps telling you this. I told her this. We talked for a while. We hugged. I sent her on her way with her information, told her the doctors that I loved in town. And my nurse comes into the room. I'm with the next patient. And she's like, oh, my God, you have to come out of the room right now. There's an emergency. She had pulled over and had a full-blown panic attack and was hyperventilating on the phone. It's almost like when people hear the word cancer.
Yeah.
And she had, when I said infertility to her, she heard that you will never have a baby. She, after that, her mind shut off and she stopped listening to anything else I had to say. So even way before my involvement in the campaign, I learned from a patient, not in medical school and residency, about sensitivity training and really being selective about how powerful our words are with our patients. So thank you for that incredible work that you've done.
Well, it's interesting that you bring up that it was like saying the word cancer because there's a study that actually showed that people who have a diagnosis of infertility feel that same level of stress, emotion, sadness that they do when they have a diagnosis of cancer or being told that they do. So it is a very strong word when it's being used. And I think what's been helpful the last, I would say, decade or even longer now is that because people are going out and they're sharing their experiences, their stories, people are realizing that are not alone. And the World Health Organization with that number 1 in 6 people globally have infertility has also been helpful. But I feel, and tell me if I'm wrong, I feel that it's starting to remove some of that stigma. Yeah. A little bit at a time.
Oh, yeah.
And I'm hoping that we do reach a point, in the near future where people don't feel that way when they're told that they have infertility. It ends up being something that they see as like, okay, it is a condition, it's a disease that I have, but there are things out there that will help me grow my family. And it just means it's a slightly different pathway than I had initially envisioned, but I will get to my goal in the end.
And thanks to you, it may be affordable. But no, I agree with you. With more investment in the space, more data, more research, like I didn't even know about the paper that you're alluding to, more celebrities in the space, with researchers and providers, more and more people being vulnerable and being willing to speak up about it. I think it's giving other people a safe space to share, to learn from each other, and to access the care that they need. So we are changing the status quo. And neither one of us, I think, thought that we'd be doing the work that we are today. All right. So changing gears. In my family, they joke, we're both Pakistani. So you grow up, and I don't know if you grew up, doctor, lawyer, engineer, right?
Oh, yeah.
Yeah. And so in my family, that's not been the case. You're either a doctor or you go into sports. Like my son, my son works with Washington.
That's like a different kind of Pakistani. I haven't met one of you before.
But we're also growing up in Cleveland. Right? The weather was horrible. And most Pakistani people don't ski or ice skate. And so my parents would take us to sports events. Like we would go to football games and baseball games. And so we were sports lovers. And so my brother's in sports. He works for an NFL team. My brother-in-law works for a sports organization. My daughter is transferring to OSU, and she's studying sports management as well.
That's amazing. I actually want to do another podcast just hearing about your family like, involvement in
And the
sports.
interest. It's like you're sports or you're a doctor, but you've landed some incredible enterprise partnerships. And through this and watching the news, and actually I just got invited to an event about investing through women's sports into healthcare and inviting leaders who are now investing in women's sports because more and more people are watching. But what do you think about this movement that we're seeing in the sports industry, whether it's female sports or male sports? I feel like they're spending more money, not just on health of their athletes, but of the employees of the organization. Any feelings about this, excitement or thoughts?
I mean, so we have customers in almost every industry. You would think traditionally tech.
Right.
So that's definitely, you know, a significant portion of our customers, but manufacturing, automotive, retail, and sports amongst, you know, the types of customers that we have. So I actually think it's important for them to see that people who are in the sports, I guess, space, whether it's like whether you're the athlete themselves or working, you know, in the organization in some other form, because when you think of sports, you're thinking of people who have, like, they're almost like role models of health, right?
Agreed.
Whatever type of sport it is, you're thinking that this person's, like, I hate to say like ideal, but almost like your ideal of what optimal health should be.
Yes,
Whether it's like their muscle mass or their endurance or just
nutrition,
the skill, their nutrition, whatever it may be, that's what people look to. Like you are the role model. So to be able to then have, like, to provide then them the tools that they need to optimize their health and their reproductive health and, you know, their hormonal health is really important. And then if they are, you know, comfortable speaking about it, I think that's great because, again, these are people that you're looking to learn about how to have your health optimization, right?
I agree because when they look at LeBron James, right, 'cause he's from Cleveland, or you look at a Tom Brady, you know, you think about longevity and you think about, okay, what are they doing for their exercise routine? What are they doing for their meals? What are they doing? And yeah, female athletes are almost celebs and people want to emulate what they're doing because not only do they want to look and feel like them and perform like them, but they want that same level of health, but they want it accessible. So I think that the sports industry is always ahead of its time. I mean, think about it, right? They called COVID before anyone else did and said, yeah, we're shutting down for a while. So I think they've always been ahead of their time. They're really innovative. So I think if they can really lead this change and this charge, especially as we see this heightened awareness, like I never thought my son would be working for a women's soccer team. And he's so proud. Not that there's anything wrong with it, but they actually are going to have a second team there in DC because there's so much interest. I think it's phenomenal what's finally happening in this country.
And that's the thing is, like, people will then realize, hey, like, this person's like super healthy. They're doing they're exercising, they're eating well, they have people who are helping them. Yet, even if you are healthy, you can still have fertility struggles.
Absolutely.
And it's okay, even if you're healthy, you can have endometriosis, you can have PCOS. But then how do you address it?
Right.
And what types of treatments are out there that can potentially work for you? And then being able to go out there and talk about that and share that is going to be really, I think it's going to be really valuable.
And I love removing that blame and that stigma and that shame because I think so many people, when they hear that they're going to have a fertility struggle, they start to blame themselves. And what did I do? And I didn't do this. I didn't eat healthy enough, or I waited too long, or you know what I mean? Or I just didn't know that, you know, fibroids could cause this and I just sat on it too long. And I think by removing that and empowering people, we have a real way to help them get the care that they need and remove that stigma. But I got to, I had a bucket list moment. I was in the Oprah audience a couple weeks ago and
I saw that. I was like, I was really excited.
I was like, yeah, I'll sit there. And I actually got to say hello to her. It was amazing. But she was like, you can't out yoga, out think, out meditate. She's like, no matter what you have access to, if you're lucky, I like the way she framed it,
Yeah.
to live long enough.
Yeah, exactly. That's what I say
Menopause
too.
is coming for you.
If we're lucky.
Yeah, if you're lucky enough to live long enough. And so, but here are the tools, whether you want to treat it with hormones, whether you want to treat it with supplements, whether you want to make lifestyle changes, that I really liked the way she framed that.
And that's the other thing is like people talking about it more, whether it's Oprah, whether it's, LeBron or whoever it is. There's people of all ages listening to them.
Mm-hmm.
It's not just a certain age group. It's not just a certain demographic, right? Everyone. They have the ear of so many people. And so it is about like educating others, whether it's something that they're dealing with themselves right now or something that they'll have in the future, potentially, if we're lucky, menopause.
Right.
Or if they have a friend or a family member that's maybe suffering in silence, right?
Yeah.
With a diagnosis of endometriosis and not being diagnosed on time. I think talking about it more there's just so much value to that, because that's how you spread the word and help others recognize what they might have and then get the tools that they need to get it treated.
Absolutely.
Mm-hmm.
So yes, we're two minority founders telling you you're lucky if you get menopause. You heard that correctly.
Yes.
All right. So we're going to do some rapid fire questions
Sure.
mid-break, and then we'll get back into some deep discussion. A quote or mantra you live by?
So I know a lot of people use this, but I truly, truly believe in this, is that you should live your life as if each day is your last.
I love that. It's James Dean, right? Like a variation of
but
what...
it's because like we put so many things off till tomorrow, and I've seen enough now that I'm in my 40s where I realize that life is too short and you don't know if you're going to be here tomorrow. So whether it's going on a vacation or going on a walk with your kids or anything, right? I think you just have to prioritize as much of it as you can in that moment, because you just don't know.
Mm-hmm. So we
And
both say...
not in a negative way, in a positive way.
No, and I'm married to an oncologist.
Yeah.
So every day I hear it. So yeah, that's why we buy the shoes, take the trips, buy the dress, treat yourself. And not even, but just live your life in that
Live
manner.
your life. Live your life. Yeah.
What's
And
your-
enjoy the company of those around you. Make those phone calls, which I'm horrible about. So I
I don't think you are. Every time I reach out, I get a
need to get better.
response.
But like, if someone's leaving the house, making sure you give them that hug and kiss before
Yeah.
they leave. Just be around for those that you love too.
And I have decided this year no longer to waste energy on forcing myself into situations where I'm not welcome or that I'm not adding something, or people have shown me who they are. I'm like, okay, that's okay. Kind of almost like to let them, but a little bit different.
Yeah, where you're almost taking it as like, don't waste your time either.
Yeah, I don't waste my time either. It's too precious.
Yeah.
What's your love language?
It's funny because it's tasks. So
Huh.
I'm
Yeah,
a very
acts of
checklist-oriented person.
Yeah.
So, for example, if my husband did the dishes and took off his socks and just didn't leave them on the floor,
That
versus like getting me flowers, like I'm blown away. I think, yes, I love that.
So you're an acts of service girl, same, and I'm spending quality time.
Yeah.
So if a girlfriend or my husband is like plans a date or says, hey, I'm going to take you out or let's go do this together, I love that.
Yeah. Yeah. Being present. Yeah. If you can give me your attention while you're there versus like being on a phone or something else, like a screen. I think we're all challenged by that. But yeah.
One of the best restaurants I ever went to, we were in North Carolina visiting friends, and they collected the phones at the front in a basket, and the owner gave like a 15% discount because he wanted to get back to conversation. And if you had a sitter, which we did because our kids were younger at the time, you could text and say, here's the restaurant. And the restaurant was trained to take the number.
That's
and let me tell
great.
you, it was I think it was like a 4-hour dinner. We sat with this couple that we adore. We talked for hours, and because we were living in the moment. It was incredible. So I agree. Put down the phone as I'm holding my iPad and like be in the moment.
You're saving paper.
I am saving paper. There you go. One misconception about fertility care you would love to debunk today.
It's funny that I'm saying it again now because I feel like I say it all the time, but I still feel like when people think about infertility, they think about it being a woman's issue, and it's also something that affects men. About 40 to 50% of cases have a male factor component. So again, and I'm just going to keep repeating this.
No, but I love
until
that.
I feel that, you know, it's common knowledge is that men need to think about it too. It's not just a woman's issue.
I feel like as founders, I always love surrounding myself with really smart, capable people that inspire me.
Mm-hmm.
And so what or who inspires you in the healthcare innovation space?
I have so many inspirations.
You can share them.
I think it's people like you, Somi, and other women who are doing it all, right? In that you're not just like, I'm going to stop my life and just focus on this. Showing people that you can have a family, you can, you know, take care of patients, you can go out and affect millions of lives. I mean, you can do it all. You just have to have that drive and passion. And yes, I mean, it's not magic. You need resources too.
A team.
Yeah, exactly. I mean,
team.
I have my family. I have people that I rely on to help me with some of my day-to-day things. But if you can figure out that structure and you have that support, I mean, there are ways to do it. And I want other women to realize that it is possible, because I think a lot of times it's overwhelming, right? To think that, I think we put things off thinking that there will be a time in our lives that it'll be better to do something. Like for and this is not me, you know, bringing up fertility, but just in general, I wasn't ready to have kids in residency, but I didn't have a way to preserve my fertility, and I knew I wanted a big family, so I just started.
Yeah.
And I was an OB-GYN resident. You know what that's like.
Yeah.
And it wasn't easy, and I'm sure that there were probably people around me that felt like, hey, why did she have to do this now? She should have waited. I did have a lot of support though too, but I'm sure people thought that. But to me, I was like, I can't. I just need to do it. And it wasn't easy, but it gets done. You figure out a way.
I mean, I don't think that children we describe as organized chaos. Like there is no, people ask me, I'm like, there's no perfect time. I had one in medical school and two after residency. And that's just the way my story unfolded, you know, and I agree with you. But one of my worst moments you're like bringing up all these memories for me as I'm talking to you, I think fellow doctors, you know, because you've gone through the training, is I still remember her name. I'm not going to say it. But she pulled me aside and she's like, you're going to have to pick. You can either be a mother or be a doctor, but you can't be both.
Oh,
and
so
then years later, when I was doing my infertility rotation, now this is a true story, guess who I saw as a patient?
Oh.
That same woman who had told me years ago in medical school, because at this point I was an OBGYN resident, rotating through my infertility. And I saw her. I did not go into the room, but you know, she was on the docket, and I was like, wow. She was telling other women or dissuading them, and she had this powerful voice because she was our mentor, right? And it was really interesting. Describe Carrot Fertility in 3 words. Oh, that's hard.
300.
3. You get 3.
Okay. Accessible. Inclusive. And God, it's so hard. And this last one's hard because I'm thinking like 20 words at the same time. I'll say comprehensive.
Okay. I love it. Ooh, I love this question. We usually ask the opposite. What's a piece of advice that you were given early on and completely ignored and glad that you ignored?
Oh, I'm glad that I ignored. Oh, I feel like you just gave me one. Actually, it's funny. I keep saying it's funny because I just remember this. So one of my mentors during medical school, and this is the thing, like back then, people weren't taking off time during medical school to do a master's or taking that year or a couple years off to do other things. You just usually went straight through.
Right.
And again, I always knew I wanted to do something else. Like I wanted to see patients, but I wanted to do something else. I just didn't know what it was. So I was like thinking about like an MBA. I got into like a really good program too that I was thinking about doing. And I was also thinking about doing my master's in public health with like a focus on global health. And this person that I really respect, and actually we're still good friends. And she's really good friends with my husband now too. I reached out to her and I was like, well, what do you think? Like, should I do this MPH? And at that time she was like, I don't know. I don't think you should. I don't know if it's going to add as much value. And she was somebody that was like a mover and shaker in the healthcare space and she continues to be. And I was like, you know what? But like with my gut, I was like, I know I need to leave. I need to leave for a year. I need to do something. So I ended up doing the MPH. And that's actually where I met my husband.
Oh.
So I mean, it turned out like I got a little bonus on the side by meeting him.
Did you hear that? You're a little bonus on the side. Hey.
I feel totally happy to hear that. But I did meet a lot of really just amazing people while I was there, and it really helped shape where I ended up. But the funny part is that she actually brings that up during some of her lectures. Like someone sent me like one of the talks that she gave and she's like, mentors might not always give the best advice too. Here's an example. And it was like, I thought that was really funny, but it was also like insightful because it's true. Like sometimes you mean well in the moment and then you realize actually that might be another path to where you need, that you might take to get where you need to be.
And I think as long as the advice is coming from a good space.
Oh yeah,
like sometimes
for sure.
It's not, it's what you would do in that situation, but maybe it's not best for that other person.
Yeah.
And then owning that I think is part of like my leadership style over the last 10 years has changed so much as I've learned. What's a recent so funny. What's a recent aha moment you've had about leadership or growth?
That it's similar to what you said, is that the way you lead will change over time, and you will also continue to grow. And it's having that like lifelong growth mindset that I think makes you a good leader, and knowing that you have flaws and you're not perfect and that you can learn from others that are looking up to you for that leadership.
I agree. I think those leaders are real and they're approachable, and they're willing to work through and pivot with changes. Finish this sentence for me. Disruption looks like
taking a path that might be difficult and uncertain, but could potentially lead to improvement in the lives of others.
Okay. All right. So we both have this belief that healthcare should be accessible. I was told I was nuts when I opened a menopause sexual healthcare clinic in an insurance-based system a decade ago. In fact, I was told it was never going to work.
Why? Who are these people?
Mentors I shouldn't have listened to. But I didn't. So fertility is, or I would say historically, has been seen as a luxury due to cost. So how did you talk about comprehensive, you talk about approachable, you talked about, these trips that you took and it was so important for you. So how was your approach different to make it more affordable?
So I think one thing that I just want to clarify is that the reason people think of it as a luxury is because they haven't considered it as being an essential part of healthcare, which it is, right? It needs to be in just the overall package of healthcare. Like it's not something that's external to that. And they also think that it's like so expensive compared to other stuff because they have coverage for other things.
Right.
If they were paying for every MRI out of pocket, if they were paying for their gastric bypass surgery, if they were paying for their cardiac surgery, right? Those are all very expensive. Those are all used to treat medical conditions. And what I think is, the way that I think we should see it is like, yes, like overall healthcare is just really expensive and we need to work on that. That's another issue. Again, another podcast, another episode. But it's about making it more affordable so that burden doesn't fall on the person.
Yeah.
Right. So it's less about it being a luxury or being expensive, but more of making it affordable.
I love that.
Right?
Yeah.
That's like
Love
another
that.
way to, that's just another way to look at it. And I think Carrot's one of the ways, one of the models of making it more affordable for people. And I know there's a lot of different companies out there. There's a lot of different models. I mean, there's the whole world that's trying to address this, and there's going to be many different solutions. But I think we found a way to be able to address it in different parts of the world, and it's been working really well.
Oh gosh, girl crush. I'm like, girl, I'm fangirling over here. One of my final questions for you is, if you could envision your dream future fertility care over just the next decade, not even like 50 years from now, what does it look like?
I think it'll start early on with early education. I want girls that are my daughter's age, and of course, like they know a lot of information about all of this. Their mother's a gynecologist, their mother's an REI, they know everything. I want those girls to know about their reproductive health. I want them to know about their hormones. I want them to know what to look out for that's normal and that's abnormal. I don't want people to have a delay to their diagnosis, whether that's PCOS, endometriosis, infertility, fibroids, whatever it may be. I want them to know early on. I want them to be able to then make those decisions to optimize their healthcare and to plan for the future. And that's not to put any pressure on anyone, whether it's like, you must have children or, anything of that sort. It's more of, I know where my health is today. I know what the risk factors are given my current conditions. This is where I see my life going. This is where I'd like it to be in 10 years, 20, 30 years from now. And this is what I'm going to do. This is what my timeline looks like to get those goals met in the future.
All right. So I think to summarize our conversation, only listen to good advice. Spend time and energy on the things that you want to build, but also that build you up. If doors don't open for you, either build one of your own or kick it down.
I like that one.
Yep. The status quo has never served anyone. And I think I just will never take no for an answer. And build your girl tribe. You know, the people that, and it doesn't even have to be your girl tribe, your team that supports you so that you
your
can.
People.
Yes, your people. Build your people and support each other.
Yes.
I think when another person wins in this space of women's healthcare, it doesn't detract from your own win.
No, it's a whole world. There's so much. There's so much.
So
to
many
do.
patients, and there's so much work to be done.
Exactly.
Thank you for tuning in to The Disruptor with Dr. Ahmad and myself. We have a matching newsletter on Instagram. It's at Dr. Somi and drsomi.com, and you can subscribe to meet other disruptors and change makers. Thank you so much.
Thank you so much for having me. This was so much fun.